Hi, my name is Maggie Burton, and this is my remediation skills video for tracheostomy care. We have all our necessary equipment. My hair is pulled back out of my face, my badge, uniform, patient, nails are free of nail polish. We have our clean gloves here, and we have our tracheostomy care skills kit. It is open from practicing, but you would not use a kit that is open in a real situation. So we're gonna knock on the patient's door, provide privacy, verify name and date of birth. I'm gonna wash my hands, bring the bed up to semi-Fowler's position and good working height. Verify the patient's name of birth, wash hands. Good morning, sir. We're gonna go ahead and we're gonna do your tracheostomy care now. Here we would suction if necessary, but his is looking okay, so we don't need to do that now. So we're gonna go ahead and we're gonna open our skills kit. Throw this away. We are going to open this, making sure to only touch the outer portion to lay down our field. And then we are going to dump our skills kit. And now we are going to pour our solutions into here. We have a hydrogen peroxide and then a normal saline in the things. Okay. Now I'm going to put my clean gloves on. However, I'm just going to slightly move this over without breaking the sterile field just to make sure that I have enough room. Now I am going to wash my hands and I'm going to place my clean gloves on. Okay, we're going to go ahead and we're going to remove the oxygen from the patient. And then we are going to gently remove the inner cannula, and we are going to have it soak in the solution here to stay clean. And now I'm going to go ahead and I'm going to remove the old dressing and dispose. And now we're going to take these off with the old dressing. So I'm going to wash my hands and then I'm going to go ahead and I'm going to put on my sterile gloves. Making sure to only touch the outside portions. Here. And we're going to start with our non-dominant hand, only grabbing the fold. Okay, and now from here, I'm going to reach in, only touching the outside portion of the gloves inside the fold and reach my hand in. If these want to go on, there we go. Okay. Now our sterile gloves are on. We're going to dispose of this. Okay, so now we are going to take our brush and we are going to clean the inner cannula. And then we are going to replace it in here. And we're going to lock it in. Okay. We're also going to have our gauze pads here, or Q-tips, soaking in the solution. So now that our cannula is clean, we have our large Q-tips that have been soaking in the solution. We're going to go ahead and we are going to clean right around the tracheostomy tube. So swipe, dispose, swipe, dispose, wipe, dispose, and we would use the hydrogen peroxide solution for any crusties, and dispose. Now we are going to take one of our gauze pads to go ahead and we're going to dry around the tracheotomy. Okay, now once that is dry, we're going to go ahead and we are going to apply the sterile saline. I'm sorry, the sterile gauze. Now that that is done, we're going to go ahead and we are going to release the current tie that is on and place a new tie on here. So this was done doing the one-tie method, and that's how we are going to do ours. Disposing of the old tie and getting our new one here. Making sure that the tracheostomy stays in place in the inner cannula. And we want to make sure that it is not too loose on the patient and not too tight. Okay, so is that comfortable for you? Okay. Okay. And now we are going to take another piece of gauze and we're going to place it underneath the knot to make sure that the knot is not rubbing on the patient's neck and causing discomfort. Okay, and now we have completed his tracheostomy care. We are going to dispose of everything, wash our hands, place the patient's bed back into a position, and leave the room and document.